Thank you, and good morning to everyone, and thank you to our speakers this morning for setting the stage and being so inspiring with their comments. We have a wonderful cadre of panelists, and I could spend certainly a half an hour or 45 minutes speaking about their numerous achievements, but in the interest of stimulating discussion and acting on what Jeff said is today is an ideas day, and we want to welcome your ideas. We will get started with the panel. Just for background information, we did provide a certain number of catalyst questions to the panelists, asking them what should the research, what kind of research do we need to develop, what kind of infrastructures do we need, and so on and so forth. But with the ideas that have been brought forward this morning, as well as the many ideas and experiences of our panelists, we'll jump right into the discussion. Each speaker will have about 5 minutes to provide some opening comments, and then we will follow up with discussion. And please, right now, for both the people who are present here and those who are online, start thinking of your questions because we really want to engage you in identifying different ideas. And so I'd like us to start off with, we're going to ask Nicole Redvers to provide us with her opening comments. And Nicole is a Western Research Chair and Director of Indigenous Planetary Health at Western University in London, Ontario, and an associate professor at Western. So Nicole, why don't you open the discussion, and welcome.
Thank you, Masi Cho. I'm just going to make the assumption you can hear me okay on that end.
We hear you very well, thank you.
Wonderful, perfect. Well, Tlanatea, hello everyone. I'm sad to not be there in person. I'm coming off of a fairly busy ICAM or International Congress of Medicine, and 2 days before that was in some CCA meetings about developing the Northern and Arctic research system around climate change and the environment. So it's just sort of naturally fitting to come to this session here today, having some of the great experiences over the weekend and hearing some great discussions going forward. I'm going to just share screen for a second. I'm just sharing one particular slide. And I'm a member of the Dene-Nukwe First Nation, come from Treaty 8 territory up in Denedeh. And when I think about the North, this is actually a picture of Tuktoyaktuk. This was an image that was shared by Letitia Pokiak. And you can imagine looking at the town, the hamlet of Tuktoyaktuk, what the impacts of climate change may be as a part of sea level rising, but also erosion, and then some of the challenges with infrastructure living in such a place. And when I think about this topic and what needs to be done, I always think about my mum. I think about my mum, who's right now in Dene-Nukwe First Nation up in the Northwest Territories. I think about the last few days where the oil sands hearings were going on because we are at the mouth of the Slave River, which is fed by 70% of the waterways coming from the Athabasca watershed. And I think about the impacts of climate change in that area, the impacts on our plants and animals. And for me, this is a very personalized topic. And I think for many Indigenous peoples coming to this topic, this just is not about an environment. It's not about research. It's not about a study. This is about our lives. This is about where we're able to live, what we're able to eat, what we're able to pick, what cultural practices we're able to do. All of that is completely intertwined with this aspect of health of the environment, health of the planet. So because of that, it creates an urgency for us beyond the immediacy of change in 5, 10, 15, 20 years from now as we're attempting to meet global climate targets or otherwise. This is having impacts right now where landscapes are changing. We're warming at 4 times the global rate within our area. Yet at the same time, those very same communities, Dene-Nukwe, many of the First Nation communities around Northern Alberta and the Southern Northwest Territories have been asking for environmental research for decades based on impacts of environmental contaminants from the oil sands potentially and also otherwise. Yet despite calls for many environmental research studies, we have yet to be able to do that because of a lack of structure, a lack of grant availability, and a lack of provincial and federal interests in terms of this. So the agendas are very clear in the North. Environment, climate change are part and parcel with our realities. We want to be able to carry out research studies. We want to be able to be doing appropriate assessments, self-determined by Indigenous communities. Yet there's no infrastructure within the federal granting agencies to allow that to happen currently. So because of that, I had this few slides presentation prepared, but I decided just to scrap that and talk about this, because after I read the hearings on what happened at the federal government in regards to some of the oil sands, it just made me reflect on home and what this actually means for my family, for our community, for our people across the North, but also seeing this as a code red warning sign for the impacts in the rest of Canada, and how frankly unprepared we are comparatively to other circumpolar countries in regards to our funding infrastructure, the amount of money. In fact, just as an example, Northern Arctic research, we have countries outside of Canada funding more research than Canada in the Canadian Arctic and North. That is the reality of the situation. We have other countries putting more money into Arctic and Northern research than Canada does itself. And there'll be a report out towards the end of this year demonstrating those statistics as well. So I encourage folks to keep an eye out for that with the Canadian Council of Academies. So with that, I know we're going to have some robust discussions and talking about some further things here, and some wonderful other panelists to open us up. But I just wanted to share those reflections and thoughts before we get into some of the discussions. So Masi Cho, thank you, appreciate it, and I'll pass it on.
Thank you very much. That was very, very lovely opening statements and some very important ideas that were stated here. We will be able to come back to them throughout the discussion. So we'll go on to our next speaker, who is Trevor Hancock. And Trevor is a public health physician and a former professor at the University of Victoria. Probably that many of you have read his work on the his writings on the Anthropocene. And so Trevor, up to you now.
Thank you, and good morning to everybody. It's pretty early out here in Victoria on the traditional and unceded territories of the Lekwungen-speaking people. I am going to talk to you about the topic you see right in front of you on the screen there, and I'm going to whip through this very quickly because I've got a lot of slides, but they basically are text taken from the document you have in front of you on the tables, and I hope the folks online have it too. I am part of a working group that in turn is part of a national working group that came together on World Health Day last year to develop an open letter to the First Ministers of Canada about planetary health and societal well-being, and we're continuing our work. And this issue of an Institute for Research on Environment's Health and Well-being is one of those ongoing streams of work. We are concerned with the global ecological changes that Nicole just touched on, and we're also concerned with the fact that there is no CIHR Institute for Research in this area and never has been, and that's a problem. We're waging war on nature is the way Antonio Guterres has put it. Humanity is waging war on nature, and this is suicidal. Climate change alone, as you well know, I hope, has been called the single biggest health threat facing humanity. Now, just 3 days ago, the Association of Canadian Faculties of Medicine released a declaration on planetary health, and in fact, Nicole Redvers was part of putting this together. Thank you, Nicole. Academic health institutions declare the health of the planet a code red emergency and call for immediate implementation of planetary health education and research. So the academic faculties understand this entirely. But it's not just the natural environment. We live 100% of the time within natural ecosystems, but we also spend 90% of our time indoors in North America, and we're 80% urbanized. So the built environment, which is nested within natural environment, is a hugely important factor. And as Winston Churchill said, first we shape our buildings, then they shape us. But also the way we design and build our towns and cities shapes the environment around it too, and the global environment. So all of those are within the remit of our concern around these issues. We also recognize environmental justice is a key issue in this area, that the impacts of massive and rapid global ecological changes and the design and quality of our built environment are not experienced equally. And in particular, we recognize the important role of Indigenous people and Indigenous knowledges and perspectives and practices, as indeed does the UN and many others. And what Nicole just touched on is totally central to this. I found this powerful statement in the report of the Truth and Reconciliation Commission. Reconciliation will never occur unless we're also reconciled with the earth. And we recognize that this requires a decolonizing lens in future research investment and so on. Our position is really very simple. The absence of an institute devoted to the study of environments, health and well-being is untenable, as human-induced changes to our planetary life support systems are becoming a major threat to the health of humans and all species in Canada and around the world. So this has to become a central concern of health research in general, as indeed the faculties of medicine just demonstrated. Society itself needs this. We need to research the impacts of environmental change on human health and well-being and on health systems too. And we need to engender a next generation of innovative, evidence-informed actions that not only reduce harm, but seek to improve the natural and built environment by addressing the drivers of environmental change. So these are very profound sets of issues that are not limited to the environmental sciences or the health sciences, but spill out across really all of the disciplines. We recognize that this is complex interdisciplinary work and that we have to consider the social and political and economic and legal and related drivers of ecosystem decline and how those shape health and well-being. So it spans across all of the disciplines. Again, it is something that is recognized in the Academic Health Institution's Declaration on Planetary Health from 3 days ago. The need to de-silo efforts and lead planetary health research, policy and advocacy aimed at real-world implementation of solutions. I stress real-world implementation of solutions. I stress advocacy. It's not just about the research, it's about what you then do with it. The areas that we see encompassed in such an institute, which incidentally we think would probably need to be some form of tri-council institute, we're not quite sure because we're still developing this, what this should look like, but we think it has to span beyond any one of the tri-councils and really be a tri-council initiative. But it spans all of the issues you see here and more. I'm not going to go through this slide in detail. But the benefits are that we need to understand what we're facing. We need to understand the drivers of what we're facing. We need to understand the changes that are needed and the best way to meet those challenges, to make those changes and track progress. And that would be the work of an institute such as the one that we are suggesting. And this would enable the transition to what the WHO in the Geneva Charter for Wellbeing has called a well-being society, and this is a quote from their charter, one that ensures equitable health now and future generations without breaching ecological limits. So that is the view of this group, and this is the members of that group thus far. We're launching our draft right now. You're the first people outside of the group to see this. We intend to take this work further, to refine this. We would welcome any and all of you to participate with us in this really important task of ensuring that Canada does indeed create an institute for research on environments, well-being and health. Thank you.
Thank you, Trevor. That was indeed inspiring as well. Perhaps you can put in the chat if people do want to join the team, if you could perhaps write something in the chat where people could, who they should write to or how they can get on board. But we'll go to our next speaker now. So I'd like to ask Samira, who's here with us today, Samira Mubareka, who's a medical microbiologist and infectious disease physician at Sunnybrook. She's a lead at the Royal Society of Canada One Health Task Force. She's an associate professor, Laboratory of Medicine and Pathobiology at the University of Toronto, welcome, Samira.
Thank you very much, Lise. Do you want me to speak from the podium?
I think, we'll have you sit down, and then you just have to press on the button to turn on the sound.
Good. And Alan, I believe you have slides, if that's okay. Oh, thank you very much. So thank you very much for the invitation and for the kind introduction. Bonjour à tout le monde, à tous et à toutes. So I come from an infectious diseases background and have worked on interspecies transmission of infectious diseases and emerging pathogens. And I wanted to take this opportunity to really underscore something that I think has been lacking in terms of our focus on how we approach emerging infectious diseases. And that's really a systems approach to understanding the complexities of spillover. So the concept of land use-induced spillover is something that Raina Plowright and others have put forward. And I think now with the pandemic revealing some pretty clear breaches in our understanding of what drives spillover, we have a really important opportunity ahead of us to fill some of those gaps. So we know that pristine ecosystems are very protective. They're rich in biodiversity. This dilutes pathogens. There are many protective effects that get breached with human incursion into those ecosystems. So those breaches, probably best studied in tropical settings, but certainly in principle can always happen in temperate and other climates as well. Those breaches do a couple of things. So they affect the ecology of reservoir species. They also affect the ecology of pathogens that those species harbor, and they often bring humans and other species, sometimes livestock, for example, so it's not always direct, into closer contact with said pathogens. So this has been happening very frequently and more frequently in the past, and this is why we're seeing, spillover of Mpox, Ebola, Marburg virus, SARS coronavirus 2, and other pathogens increasing. So what can we do about this? So this is sort of Jeff, you mentioned earlier big ideas. This is sort of the big idea I want to pitch today, and this is about rethinking immunity. We know a lot about immunity. We don't know everything, but we know a lot about immunity at the molecular level, at the host level, at the population level. But we don't really talk about immunity at the landscape level. This is ecological resilience, and we're really starting to understand some of the drivers of pathogen spillover, but we don't understand, and we certainly don't pay enough attention to this concept of landscape immunity. Again, credit to, this is not my idea, this is Raina Plowright's idea, but I really want to put it forward. She puts forward a paradigm of infect, shed, spill, and spread. And if we want to prevent this, landscape immunity is absolutely essential. So it has to be connected to some of the more fundamental, molecular concepts. We know this from SARS-2. We know a couple of changes in a receptor binding domain can change species specificity and spillover. So these are not mutually exclusive. Understanding things at scale and working together at scale is really important as well. So we shouldn't be siloed in that respect. And there are a number of different things that could be done in terms of protecting landscape immunity. If we think about the dominoes that, if we keep them standing, prevent spillover, they include things like biodiversity, habitat protection, wildlife health, etc. So if we think about maybe a problem at hand, I mentioned that this has been more extensively studied in tropical settings, but right here in our house, we have highly pathogenic influenza. We know that it is diffusely distributed through shorebirds, and unfortunately now spilling over into wildlife and causing mass die-offs in mammals as well. So this is an unprecedented situation. We know that the virus is reassorting. It has now adapted to mammals in some respects, and the mortality is high in some species. Risk to humans remains low, so we really have an important opportunity here to think about how landscape immunity and how we protecting landscape immunity can also prevent spillover of highly pathogenic avian influenza virus. So I won't go through this slide in detail, but the WHO One Health high-level expert panel, as well as the quadripartite joint plan of action for One Health, have provided some framework in terms of how we can start to do this. I'll just highlight perhaps the first and the last point. So research and risk assessment on the drivers, processes, and pathways for zoonotic diseases. This includes understanding and appreciating how ecological resilience and health systems are really critical to this. And then to do this in a manner, so going down to the last point, that engages local communities, including Indigenous peoples, so that we identify solutions that are nature-based, and so that we are all better prepared and maintain ecological resilience. So that's it for me. Merci, Lise.
Merci beaucoup. Ça a été vraiment merveilleux. Merci. So we'll go on to our next speaker. We're happy to have with us David Balshaw. He's the Chief of Exposure Response and Technology Branch at the National Institute of Environmental Health Sciences in the United States. Welcome to Canada virtually, David.
Thank you, Lise. And greetings from North Carolina, the lands of the native Occaneechi and Eno people is where I'm speaking from today. Sorry I could not join you there in Ottawa. So I wanted to some of the things that Nancy and others this morning have said really resonated with me as well, and some of the points that I wanted to convey in my talking points. You know, we do have a slightly different view coming from the United States rather than Canada, but we're struggling with the same issues that you are, I think. You know, one of the biggest ones is, you know, the context of environment and thinking about not just the individual exposures that we encounter in any given place or time, but thinking about the context in which that exposure occurs and you know, how that interfaces with our social environment, our own innate biology, physiology, as well as the other chemical and physical exposures that we are experiencing. So this is, you know, leading towards the idea of the exposome. We recognize that the true definition Chris Wilde laid out in 2005 of the exposome is the totality of everything that we are exposed to from the time we are conceived to the time we die is not realistic. We're never going to be able to get there, but we can embrace the complexity of the environment and measure multiple things in a comprehensive way. So, you know, as we've been thinking about this over the last 15 years, you know, we've developed a series of new technologies, and we have technologies at a level, you know, and through efforts such as Canoe as well. It's not just here in the United States. You know, we can think of ourselves as being analogous to, you know, the efforts that were convened in the Human Genome Project and through the fields of genomics, transcriptomics, and what have you. You know, we're roughly where they were 20 years ago. We have fundamental technologies that allow us to do more, to measure more than a single gene at a time, but we're not to the level where that can just be implemented in any study at any given time. And we need to think of this problem as a global problem. It is not something that we can do alone in the United States, that you can do alone in Canada, that the European Commission can do alone in Europe. We need a global coordination effort around how we do this work as a global community. We need to be having conversations about what are the technologies that we have, what are their strengths, what are their limitations, how do we standardize and harmonize those methodologies between laboratories. We need to be thinking about the data and metadata standards that will allow us to compare the work that is being done in one laboratory or one study to those of another. We need to be thinking about where are the gaps in those technologies and where do we need fundamentally new approaches. You know, if we're at the level of you know, what transcriptomics was doing with the Affy and Agilent arrays, you know, we need the shift to an RNA-seq that allows us to do a much higher throughput, much lower cost, much more standardized, harmonizable study than what we are currently able to do. And then we need to think about how we translate those technologies and those methodologies into studies that will actually have the power to be able to look across multiple exposures simultaneously. So we've been having lots of conversations with the very largest studies in the world, things like the All of Us program at NIH, but also things like the 100,000 participant cohort coalition, the ICDA, the Global Alliance that Senator Kutcher referred to in his comments. Of how do we translate these technologies and use those massive studies as a test bed to demonstrate the power of these and begin to address the most pressing challenges that we face as a global society, things such as other speakers have addressed, the challenges of climate change and its impact on our health, the challenges of environmental justice. I think you've been thinking of the same challenges in Canada using a slightly different term, but addressing the historic policies and practices that have been put in place that affect the most vulnerable populations with the highest burden of exposure. We need to correct those things. We need to have efforts to identify, not the PFAS. We know those are a problem. Not the things that we know are historic problems necessarily, but the emerging contaminants of concern. The things that we don't know that we are exposed to that are likely to burden our healths and livelihoods going forward. We need to one of the things that we have been pushing at NIEHS is an emerging concept of precision and environmental health, which seeks not to identify the risks and burdens at a population scale, but really thinking about N of one biology and thinking about how do we apply these concepts in individual risk assessment and driving individual action to prevent and lessen the burden of disease, and thinking in terms of how can we optimize the health of an individual going forward, and in so doing, improve the health of the larger population. So with that, I think I will close up my 5 minutes of introductory comments and turn it back over to you.
Thank you. That was terrific. And we will come back to many of the ideas that you have raised a little bit later in the discussion. But now I'd like to welcome friend and colleague Michael Brower, who's a professor at the School of Population and Public Health at the University of British Columbia. He's an affiliate professor at the Institute for Health Metrics and Evaluation as well. Michael?
Thanks very much, and really honored to follow everybody else who's on the panel. I think you've heard from the other panelists the imperative, the need to continue the work that we're doing, and really a greater need, an increasing need that is going to be with us for many, many years to come. Along with that, I think it's important also to recognize the strengths that we have in Canada. We think about the ways that we should move forward. A particular shout out to Canoe, really emphasizing the real strengths we have, and I work a lot elsewhere in the world. Our data linkage is really second to none. Our ability to actually link both at local levels, nationally, and Canoe really adding sort of environmental measures to many of our cohorts, to our administrative data systems that we have, and really that's provided a lot of benefits. Another strength that we have in Canada is we're just about the right size for collaboration. So we're not too big that we're fighting with each other. And we're big enough that we have the expertise to actually to do meaningful collaborative research. We've seen over the past decade, certainly also a wonderful mix of both breadth and depth in our analyses. And I'll call out the CLSA as a great example of something that's large enough, but is not too large to become unwieldy, and it's large enough and it's deep enough that we can actually ask very detailed questions. So both kind of within individual studies as well as our mosaic of the research portfolio that we have in Canada, we have the ability to have very large studies, especially through our data linkage, and deep, smaller studies that build upon that. So as we look forward, I think it's important to think about some other challenges that we're going to face, and think about the system context. So we've heard about climate change, we've heard about One Health and ecosystem perspective. What about the population health challenge, and what about that context? So one of the things that I haven't heard much talk about in the last day and a half is really the aging of our population. This is really going to change the health landscape and change it dramatically. So how does environment play into that in terms of NCDs, in terms of antibiotic resistance, in terms of pandemic preparedness, and really a fundamentally changed population that is not only going to stress the healthcare resources, but also, in fact, to stress the entire country and our economy. We've heard also lots about equity, a multi-exposure approach as well. From the perspective of moving forward, climate change is really the big issue in terms of the environment. Not that it's anything different. It's going to affect all the environmental factors that we've been dealing with. It's also where all the action is going to be. So I'd suggest we think about climate change as a driver to address other challenges, using all the climate action actually to address longstanding health inequities, longstanding environmental issues that we've all faced. And in addition, a real emphasis on adaptation, including how is climate change going to affect actually migration of populations to Canada as well as within Canada. My vision, just to wrap up, would be that we, in the future, really consider environment in all aspects of health research. So embedding environment in health research more generally. And in the field that I spend most of my time and most of my career in air pollution, we're really starting to see this. And it's actually that air pollution started to be taken very seriously now by the health community, where we're starting to see action, certainly in a global perspective. So I'll close with that.
Thank you. We've had a number of really interesting points that have been raised, but maybe just to set the context, and I'd like to challenge the speakers. For example, Nicole indicated that other countries were investing more than Canada was investing in the circumpolar research. Trevor, of course, provided an overview of what a new institute might look at. Samira talked about a number of interspecies aspects that we have to consider. David talked about the situation in the United States, about looking at exposome and the fact that we have numerous technologies. And Michael mentioned some of the strengths and some of the challenges. But maybe just I could ask the speakers, one of the points that Nancy raised this morning was don't boil the ocean. We have to identify selected nexus areas. So I'm wondering if I might ask the speakers to say, given what has been said yesterday and what we've heard this morning, where do we start exactly? There's a proposal for an institute, but how do we go about that, and what are some of the ideas that we can move forward with? In any order.
Well, I'll jump in since someone's got to start. I didn't actually catch the early part of Nancy's comments, a little early in the morning for me, but the notion of boiling the ocean. I think that I'm on the board of Science Advisory Board of something called the Cascade Institute out here in Victoria, set up by Thomas Homer Dixon. And it is about complexity science. It's about looking at the complexity of environmental, economic, social complexes and what that does in terms of the global challenges we face. And I think that you may call that boiling the ocean, but the challenges we face are profound and are certainly not limited to the exposome or to toxics or to infectious agents or whatever. At its simplest, Canada has an ecological footprint of roughly 5 planets worth of biocapacity every year. Clearly unsustainable. Clearly, if the whole world lived like we do, we'd need 4 more planets. And so we are going to have to dramatically reduce our ecological impact. And in doing that, we're going to, as Naomi Klein put it in a book about capitalism and climate change, we're going to have to change everything. And so not looking at how we change everything in order to safeguard the biosphere that is our ultimate determinant of health is to give up on the most important challenge we face. So I think we need to step back and see the big picture of not just the global ecological changes that are happening, but the underlying social and political and cultural values that are driving the system, that the economic and social systems that are creating these global ecological challenges, of which pandemics and toxics and so on are expressions of that global challenge. But fundamentally, this comes down to issues that affect every faculty and every discipline. I've worked at University of Victoria, and we set up a group called UVic in the Anthropocene. And one of the points of that group is that if you really want to address the challenges of the Anthropocene, you need to involve law and business and politics and the humanities and the arts and so on, because they all have a role to play in bringing about the societal change. And I think that the research we need is the research not only on how does the environment affect our health, but what do we then do about it in response to understanding what those challenges to the health of the population are. And this is the health not just of the Canadian population, this is population health at a global level. So we need to be looking at population health in Canada, but doing so and looking at our actions in a global context. So that's the kind of research institute I think we need, that is, as the academic institute said, transdisciplinary, bringing in all of these other sectors as well. That is the modern day, that is the 21st century reality that we face, and that's the challenge to research in the area of health and environment.
Thank you. Any reactions, further comments? Michael?
So, yeah, I think I would suggest, in terms of focus, I think there's 2 aspects to this. So one is that the impact of environment on health is a way to drive change in the environmental context. So I think that's really more of an advocacy perspective, and we should all be engaging in that. I don't think there's any question about that. But in terms of focus on research, I would argue that the emphasis really should be, what are the specific impacts on health, on the diseases, let's say that all the CIHR institutes are addressing. We as environmental health research should be posing the question, for the diseases that you're focused on, what is the role of environment? And if you don't know, we better find out. If you do know, what are we doing about it in terms of action? So we have, and this is sort of my hat, working on the global burden of disease. That's really what actually brings environment into the forefront, is when you can identify it contributes X amount to this disease. That's where the money is, that's where the funding is. That's actually what people experience. And if we don't know that for the major health challenges that we face in Canada, then we need to figure that out.
Yeah, and if I can just build on what Michael said a little bit, that's experience that we've had here in the United States as well. We've been having lots of conversation with our sister NIH institutes that have historically not focused on the role of environment in their outcomes, whether that's cancer or neurodegenerative disease or whatever. And we've started having conversations with them that, we know that environmental factors are both causative, but also altering the progression of these diseases. And we need to build partnerships. We have the expertise in how you measure the exposure. You have the expertise in the health outcomes. We need to work in partnership in order to really address these challenges. It's again the analogy to the Human Genome Project. We don't have to make the argument now that genes are important in health, because we've had the conversation for 50 years that genes are important for health. We need to be building that conversation that the environment is just as important, if not more important, in health as the genes are. And we need the partnership with the other expertise to be able to find those commonalities.
I could maybe just jump in here. One of the things I think about is because of the urgency, because of the issues that are coming, it's often jumping right down to the bits and pieces. But I think one of the fundamental questions for me, and I'll just go ahead and share a screen here, is how do we see the world? How do we see the world as researchers and our vision and values within a system? Do we see ourselves and science serving the benefits of humans, or do we see humans as a part of a very small part of a wider system? And when I reflect on working with communities and with elders, they always talk about vision and values first, because what is it that we platform as important components to this? Because if that's not done, what I worry about is that we're just going to continue to create similar issues, because we're looking at things through the same worldview that created the problems in the first place. And I often will say this: we can't solve complex problems from the same worldview that created it in the first place. If we're just perpetuating the exact same notions of what science serves, then how does that actually change and get us in the end, particularly when it comes to what the senator was talking about before about disinformation and the separation between having loads. We know that we have all the science we need for climate change, yet we don't see the movement happening. And I think this is where the missing piece of the well-being component and some of the societal impacts of implementation are clearly missing, because we often focus on the biomedical components without how those are actually going to interchange into substantial effort when we have 10, 15 years to be able to make impacts, not only on climate change, but on biodiversity and on pollution as well. So going back to vision, values, what is the language, what is the structure, and how do we actually think creatively? Because what we are doing right now is not working. It is not working. It is not working what we are doing right now. The structures that we are working in are not working. They're continuing to perpetuate the problems that we have. So I think we need to take a step back and think about, well, what are the fundamental drivers that make us go? How are we viewing the environment? Is it a place of harm, or is it a place of health? And that fundamental difference in the viewpoint really changed the structure of the implementation approach, but also potentially the inclusion of varying forms of sciences, including indigenous sciences, which are innately transdisciplinary and have been doing transdisciplinary work for thousands of years, and bridging some of the expertise about how do we actually work across systems? How do we bridge in different viewpoints and the gifts of multiple perspectives as we move this work forward? So I just wanted to note that. Masi.
Yes, please go ahead.
Briefly, after what Nicole said, I think we really need to rethink human exceptionalism. That really seems to be one of the major challenges right now, and having that anthropocentric approach, I think, is, as Nicole mentioned, really what got us into this situation in the first place.
Thank you. So let me go back with perhaps some more operational issues. So what kind of funding mechanisms do we need? We need, I think there's been a suggestion that we need a new institute, but what would this new institute look like? Where would it be seated? How might it be governed? What might it look like? Any ideas that people would like to share about how to kickstart? There is a working group. Is it about continuing the working group, or is it about bringing other people on board? Samira, please.
So from what I understand, and the CIHR can, or the Tri-Council can correct me, but I believe that there is a multidisciplinary panel that's being piloted. So it's a Tri-Council effort, it's a transdisciplinary panel. I'm not sure what the framing of it is and for how long, but that's certainly one start. From what I understand, it's NSERC, SHRC, and CIHR, and you can apply. I applied to this panel through CIHR, but I believe it can be done through any of the Tri-Councils, and I think that that's a start. It's not, at this point, something that appears to be permanent in any way, but it would be, I actually think it would be very helpful to hear whether anyone else has had in the room or online has had experience with this, and maybe from the agencies, whether or not this is something that may be potentially viewed as a longer-term initiative.
Maybe if I can just pick up on that, because of course that's what this group, and we're an informal group, we're certainly open to anyone coming and joining us and helping us to further develop and refine what we have in mind. But I mean, David is speaking to us from, as it says right in his background, the National Institute of Environmental Health Sciences. We don't have anything equivalent to that in Canada, and it's been there for a long time. We need something like that, but I would say updated in the way that Nicole was talking about how we think about environment and people and health, which is also fundamental to the approach that I think we're taking. But we don't want to see a series of one-offs such as EHSI, which, 5 years funding or whatever it was and then gone. That's not good enough. This is a major, in fact, arguably the major challenge facing us, is how we live in good health and in harmony with each other and with other species on this one small planet. I was just reading, and I wrote it for my weekly column. I write a weekly column for the local newspaper out here on these sorts of issues. Carl Sagan's description of the pale blue dot, which was about a picture of Earth taken by Voyager 1 in 1990 from beyond the orbit of Neptune. And it sort of it goes beyond that famous picture from 1968 of the Earth seen from the moon to see the Earth seen from beyond Neptune as literally this tiny pale blue dot. So we need to be rethinking what environment and health and people are all about in the 21st century. The old model is not going to work. And this isn't something that can be accommodated with a short-term temporary funding project. It's got to be a long-term commitment. And of course, it's very challenging. And it's challenging because if you take seriously the questions we are asking here, then it requires change in the fundamental underpinnings of our society, as Nicole said, in our vision, in our values, in our understandings of the earth and our relationship to it, and in our understandings of what an economy is about. My latest column is about the fact that why the hell do we put the economy in the center of governance? Why do we make the Minister of Finance the most important minister? Surely the Minister of Human and Social Development, or even better, of Sustainable Human and Social Development, should be the centerpiece of governance. It's not about the economy. But if you start to raise those kind of issues, that's very challenging in society. But we need research on, for example, with what is an economics of well-being. We came out of and are linked to work around the idea of a well-being economy and a well-being society. If you take a health perspective, if you take the Geneva Charter for well-being that from WHO last year seriously, then how does that guide a future institute looking at these issues? It's certainly not just a CIHR institute. It's definitely some combination of CIHR and NSERC and SHIRK. We might even look at, there's something called UK Research Initiative, which brings together 9 different funding councils in one umbrella. I've only just learned about it. I don't know enough about it to say that it's a model, but it's certainly the fact that they've got all those different research funding councils together. That's where we should be going with this, because this is a complex whole system, whole society problem we're facing, and it can't be dealt with one person at a time, or one chemical at a time, or one bacterium at a time.
Thank you. Brian, please.
Yeah, thanks very much. Jeff gave me a preview of the Institute request, and I don't think there's much debate that it makes a lot of sense. The problem is that CIHR has been the same since 2000, right? The institutes have not changed in 23 years, and there's been on the docket reviews of the institutes, and people give the thumbs up. And so, you know, you could demand or insist on a new institute, and in 20 years from now, we could be sitting in the same room. Some of us, like me, in wheelchairs at that point, probably. But the point being, it may not change. And one alternative just to think about is perhaps insisting on a cross-cutting theme. So what we do with Indigenous health, with sex and gender, with other major initiatives that have a cross-cutting lens, is we do insert those into many of the funding opportunities. So like you were suggesting, if you don't know the impact of environment on the disease that you're studying, the area that you're focused on, then you need to, you know, get that in your back pocket and have that available for every time you talk to a politician on that topic. So a cross-cutting theme may be a more immediate opportunity, and I think that's perhaps the way we're going to have to deal with it at CIHR, because I just don't see in the short term an institute materializing. That's not a decision of the scientific directors. It's a decision of government and governing council, and so that would be the focus of that approach, I would say.
Thank you for that information, Brian. I think, Michael, you wanted to follow up on that?
Yeah, I wasn't going to mention that alternative, but that's exactly what I would advocate for. And I think there's some other advantages in that then we're actually expanding the pool, we're expanding the capacity. And again, I think we've seen this in some fields. So in the work that I've done in air pollution, we've seen cardiologists now take air pollution seriously as a risk factor, just like LDL. In the same breath, and that's what we want for environment. So I think I would again push for that. I think it's achievable, and I think it also has some other advantages.
I see that Margot is there, but I think that there was another gentleman here, so I invite you to come to the microphone.
Lisa, I think Nicole was just about.
Oh, I'm sorry. And Nicole, did you have your hand raised?
No, but I'll just very briefly mention to Samira's comment about that, I can't remember what it's called, but the working group within. So there's apparently a 12 to 18 month time frame with that. One of the key, so there's a climate change grant out right now. I think the letter of intent's due May 2nd. So they're using this as a test case, as far as I know, to see the appetite and the uptake for this particular stream, cross-cutting across the agencies. So I just wanted to add that I know that that's a key part, apparently, of part of that process.
Excellent, thank you. I think you had your hand raised first because I saw it first, so Margot will let, please say your name and your affiliation.
It's Richard Vanderjack. I'm at the University of Ottawa. Thank you for allowing me to ask this question. 5 years ago, Meg Sears and we had concerns about the link between exposures to environmental toxins and public health. And I wrote, at that time, Minister Philpott, and then we had a meeting of a bunch of scientists here in Ottawa, and we actually agreed that we would work towards figuring out collectively the data linking exposures to adverse health outcomes. And there was a lot of agreement from many scientists across the country, many of whom are not in this room actually. And then after that ended up being meeting with Deputy Minister and actually subsequently Senator Kuchar last year when he was going through they're all supportive, but so far what's happened is it's come to a dead stop, no funding yet. But looking and listening yesterday, I think the idea of a data warehouse that takes into account many of the findings that are being discovered in this by different scientists in the room. What I see happening, the scientists, they create the data, but it doesn't lead to concrete action. And I think what you need to have is some overarching data governance, which is then linked with an advocacy group, which can then advocate for change, whether it be based on granular data that can lead to granular change at the community level, or it can lead to change, whether it be in the regulatory agencies or so forth, or policy changes, but the data has to be fed to press at appropriate times. Some of the questions that came to my mind, well, what about the changes you find in the microbiome in one group that might lead to increased colon cancer that you've been talking about yesterday? And you know, I can go on because the different examples I saw yesterday where intersectoral research can go on, but that's where overarching governance, I think, would be a good plan. We dubbed our thing the Canadian Environmental Health Information Infrastructure, or CHI. It doesn't really matter what you call it, but I think we really, really need this infrastructure, but work out how it can work best. But we need to make sure that the science leads to change. Would you agree?
I'll ask the speakers, would you agree? Our panelists.
Wholeheartedly.
So Samira, vote for Samira. I see David nodding. I see Nicole, the thumbs up. Michael, nodding. Trevor.
Well, we certainly need the science to make the change. Yes, the question is what sort of science and at what level? Individual versus population, the science of exposure versus the science of how you implement political and social change. So, yeah, I'm all in favor of knowing more, but it's a matter of where we need that knowledge and what we focus it on.
Thank you. I know that notes are being taken and there will be a report, so thank you for that suggestion. We'll go to the opposite end of the room, so please state your name and your organizational affiliation.
Hi, I'm Courtney Howard. I'm an emergency physician in Calgary. I've been with the Canadian Association of Physicians for the Environment for a long time. I just came from the International Conference for Academic Medicine, where we presented the declaration. And so 2 days ago, I was in a room kind of like this with medical school deans from all around the world committing to centering planetary health in their work. And so I just want to make sure that people are aware that a whole other group of people are going to be coming and asking for your help in doing things like calculating all the numbers to decarbonize healthcare systems, figuring out how best to make things resilient. So as we make a new plan, let's make sure we envelop the awareness of that giant sector entering the space into our plans. And a question I just like to ask, I've done research, I've done policy, I've done advocacy, and I've found it works the best when you're following an evidence base at every step. So you pick your target based on basic science, you take a look at the policy change literature as you go forward, you influence people in accordance with behavioral change literature, you see what the communication scientists are saying as you tailor your message, and then you deliver that based on data-driven message targeting for various audiences. And so I'm curious, as we envision evidence-aligned policy change, where we think we could house that in the midst of all of the different evidence bases that are really required to make evidence-aligned change.
Reactions from the panel, a suggestion of how we actually bridge the gap between the knowledge from different disciplines and make sure that it gets fed into programs and policy. I've got Michael.
Institute for Research on Environment's Wellbeing and Health.
That's Trevor's response. Thank you, Trevor. I see Michael wanting to add something.
Yeah, I think the answer we heard yesterday, loud and clear, is community-based research, participatory research. We actually need to figure out what individuals and communities want, and I actually don't think we've done enough of that in this space.
Okay, a call for also for community-based research that is informed by citizen and population perspectives. Thank you. Philippe,
Hi,
vous
good
nommez,
morning.
s'il vous plaît?
Yes, I'm Philip Awadala. I'm the National Scientific Director for CanPath, and I'm at the University of Toronto. So fantastic presentations this morning, and I really wanted to say I really appreciated Trevor's comment about embracing complexity across the myriad of potential environmental factors that need to be explored. And I think my question is for you, Samira. You can please have a go at it. But David touched on a couple of activities, the IHCC, for example, and the ICDA. Full disclosure, I'm on the steering committee of the IHCC, which is the International 100,000 Cohort Consortium. The thinking behind some of that development was that we needed large population cohort data. And we learned as geneticists that you needed sample sizes of at least 150,000, right? And same thing for even our own work, is that for our environmental impact on health, we needed large sample sizes because the effect sizes are not huge. And gene by environment interaction effect sizes are also going to be small, so you need big data, right? From your perspective, and thinking like a One Health type of perspective, has that kind of structure, has that come into the thinking in terms of how you bring zoonotics in and harmonizing data from different resources at both a global and a local scale? Like what do we need to make use of, to potentially capture these interactions happening at that kind of scale from the ecosystem to the individual's health?
Merci, Philippe. I think this might go back to the comment I made earlier about human exceptionalism, because we really don't have the equivalent in animal populations, right? And let alone in ecosystems. So in terms of big data sets, probably outside of humans, the species that are most well described and studied are probably agricultural commodities. I'll call it what they, and that's why, because of their economic importance, and even less so our wildlife. And of course, so we don't really have big data sets for wildlife, and we really know even less about their ecology and their, like down to the molecular level. I talked about immunity before. We know very little about wildlife immunity and drivers, suppressors, enhancers, etc. So there's a heap of work to be done. There is the pan-Canadian approach to wildlife health that has been, and actually Jane could speak to this much better than I can, but it has been signed, but it has not been implemented. So again, another opportunity for policy here. You know, the policy has been developed, but it hasn't really been implemented. And I think we need, I think we won't be able to thoroughly and comprehensively and effectively apply systems thinking if we're still focused on just human health and we're not including other species and ecosystems and how they relate to each other. Of course, we can't study all pathogens in all species at all times. There needs to be a strategy. And I think we can learn some lessons from large human cohort studies, because the same applies, right? But, you know, I think conversations around that would be incredibly helpful. And again, this is where citizen science and, you know, local communities could help guide those strategies, because if we do it from a top-down perspective, it will be a skewed perspective. Thank you.
Thank you. Any other reactions from the panel? We have another question from the audience. Margot, please identify yourself fully.
Sure. Good morning, everybody. Thanks so much to the panelists. My name is Margot Parks. I'm a professor in the School of Health Sciences at the University of Northern British Columbia, with a particular interest in the elements of these issues that impact rural, remote and northern populations, which is something that I just wanted to bring to the fore about a layer of gap. But my question, I think it's obvious from our conversations this morning that we're not looking for one solution from this discussion. There has to be a suite of responses to this enormous gap. And the reality is that there is nowhere in our systems in Canada. It's not unique to Canada. I'm familiar from Aotearoa, New Zealand, where I'm from. Australia has a very similar dilemma around the failure of funding systems to address complex interrelated issues. This is not unique to Canada. We all know that. But there is nowhere for this complexity to land in the current funding environment. Some people would say it can land in the New Frontiers Research Fund, which I think many of us would know that's just it's not really a sufficient response in the sense that it's just individual projects. There's not an overall strategic kind of vision for this. And so the other thing that I really see is that we're dealing with, most of us, because there's nowhere for this to land in an integrative way, most of us are feeling like a marginalized edge in our respective areas of research. And what we see in this room is, what we have in common is this sort of idea that there is a central connected core here that doesn't often gather. Most of us are feeling like we're at the margins of what we're doing, whether it's genetic research or integrative community-based research or bridging across species or urban research, that there's this edge, which is this connecting place. The other thing I wanted to ask is that we are talking about there's that difference between doing the same things better, which I really want us to see us do, which is, I think, that idea of we need to, Brian, you offered us, we could find a cross-link, or we could find a cross-cutting theme, but we need to deepen our research capacity to do the same things better. But what Nicole has challenged us with, and others, is we also need to do better things. There is absolute constraints to the approaches that we've been using. And so with those things in mind, that we're imagining a place to land that is that we can bring this complexity together. My question's actually mostly for David. And David, you happen to be sitting here in an institute that has some of this complexity in its title. And my question to you is, this is a particularly pointed question, you might not be able to answer it, but what are you missing out on because Canada is failing on this? And that you don't have a comparator in Canada to be in good conversation about both doing the same things better and doing better things. And we all know that Canada should do better. And we also know that there is an embarrassment about the fact that we're not doing better. One of the reasons I am not in New Zealand and am in Canada is because of the potential I saw in Canada to do this work. For the last 15 years, we are not getting there. And so my question to you, David, is, tell us what you are missing, because we need to prod the people that are showing that we are not doing well enough in Canada on this front. And Nicole's message that what we are doing is not working cannot be underscored enough, but we need to embarrass ourselves into momentum because of the fact that we're failing. So your thoughts, David, on that particular dilemma? Thank you.
Yeah, so it's a difficult question. I appreciate the ask and the concern. I think you have the capabilities, and there are existing international partnerships. We are working with your investigators. Your investigators are working with our investigators. So those partnerships do exist. Where there's a shortfall or an opportunity for growth, I think is probably a better way of saying it, is, and this is a conversation that we're having with the European Commission as well. There's no single entity to go to coordinate activities. And as we're trying to build this, one of the things that we are trying to stand up is an international community of practice around the exposure. And even in Europe, less so in Europe, in the United States to a large degree, and I think in Canada to an even larger degree, there are pockets where there is activity and expertise, but it's not coordinated. And there's no entity that can serve as the umbrella to say, if we're going to have a conversation around, harmonization of methodology, and laboratory A does an experiment on a set of samples and they will give you data, which is a truth. Laboratory B could take the same samples and give you different data, which is a different truth. It's still accurate data. Nobody's complaining about the quality of the data, but the data between those two laboratories is not comparable. And we need to be able to address that. And in order to do that, there has to be a single entity that is working with those two groups and able to take what they're finding and coordinate that with a similar program that European Commission is standing up for all of the European Union. We need a similar project in Canada. We need a similar project in Asia as well, that we can coordinate the activities that we are doing, much the way that the IHCC is doing, trying to standardize and coordinate the works that are going on around.
Any further reactions or comments from the panel on this response? Do I have any questions from the audience? I see somebody standing. Not sure. Are there questions online from participants online? I see a question there. We'll go to my left side. Please name yourself and identify your organizational affiliation, please.
Okay, I'm Meg Sears. I'm at the Ottawa Hospital Research Institute. I also lead a national group called Prevent Cancer Now. So with Prevent Cancer Now, we work to stop cancer before it starts. So we are looking at a lot of environmental contributors to good health and environmental contributors to dysfunctional health. So I've been thinking about a lot of these issues for quite a while. We participated in the amendments to the Canadian Environmental Protection Act, and one of the things that we have not talked about yet is incapacity and so on. There are, and this is kind of our approach with Prevent Cancer Now, we would like to skim off the worst of the worst and to simplify. Simplify in our science, simplify in our lives, simplify in our commerce, simplify exposures, and basically, just in the last month, we have had Canadian research coming out saying there are banned chemicals in plastic things that our children are playing with. So there are limits to what we're going to be able to achieve if we're dealing with hidden toxic chemicals. So we're I'm taking you back in a circle to what the good Senator Kutcher was talking about with the Canadian Environmental Protection Act and so on. So there is a role, I think, amongst people who really want to advance environmental health, both to improve the feasibility of actually achieving this type of research, and also advancing health without waiting for proof that something or other is harmful, because fundamentally that's unethical. So I think that we have opportunities here in agriculture. Right now in Canada, we have two camps. We have the people who are saying we need to meet our commitments under biodiversity, we need to cut our numbers of pesticides, and we have Agriculture and Agri-Food Canada with a sustainable agriculture strategy that addresses nothing of that in any substantive fashion. So we have a lot of capture within our institutions, within government, and in our committees. And so, for instance, to come to the Canadian Environmental Protection Act, we had CropLife, which is the umbrella group for pesticides, go into the committee and say, no, we should not be advancing our science. We should not be using modern science looking at markers of disease. We should be sticking with Canada's world-leading antique processes for scientific assessment. So I think that there's a lot of education in terms of what powers and what this group has to be asking for a context in which what we want to achieve is going to be more feasible. I hope that that's understandable.
I think Trevor raised his hand, and we have 2 other questions, but Trevor, I'll let you respond.
Well, very quickly, thank you, Megan. I agree with what you've said. I think one of the things we emphasize in the way we're trying to frame the proposal is that this is an institute about health and well-being. And so it's not about how do we defend ourselves from a harmful environment. It is how do we help create and shape environments, both built and natural, that are positive for health, that are health promoting. It's not about environmental disease, it's about environmental health. It's about the creation of healthy built environments. And I come out of the world of health promotion in particular, and that's exactly what we're focused on. So it's in that context that, yes, exposure and so on are all important, but we need to move beyond that into an understanding of what makes for a healthy environment, both for us and for the other species with whom we share this planet and on whom we depend. And if the environment is not healthy for them, then it isn't healthy for us. So how do we get there? And how do we do that not just at a global level, but at a local level, local conservation and so on? And how do we do it within a country where we're 80% urbanized and spend 90% of our time indoors? What does that tell? What sort of healthy environments are we talking about there? So that should be the focus of any such institute. And then it gets us into all of the social and political and ethical and cultural and faith values that we need to explore as part of that. But I'll stop because I see John McLaughlin's there. Hi, John. Nice to see you. It's been a while.
So we'll go to John's question, then Philippe, and then Tim. So John, please mention your affiliation. Many people know you, but just for
thank you,
posterity.
Lisa. And I'm John McLaughlin, a professor of epidemiology at the University of Toronto. And basically, it's lovely to see all of you. I'm sorry I couldn't be in the room with you. And Trevor, I'm always happy to listen to you first. But what a remarkable event you are all at. The integrative, transdisciplinary, et cetera, type of discussion you're leading is clearly very much needed in this particular domain. Having spent decades building population data systems in every province and trying to bring them together into national data systems, everything that you're saying rings true for me. My own career has been one with basically starting in environmental studies, finding the limitations of them, and now trying to foster the types of things that you're all talking about. Indeed, you know, at the beginning of CIHR, there was lots of discussion about an Environment Institute, but I think the timing is better now for the type of much more cross-disciplinary approach and community-based, deeply rooted, motivated by One Health has been described. This is a good time because I think that we can actually deliver in environment and health work what was not possible technically in the past. Working with Philip Awadallah as co-lead of CanPath, and I'm a strong supporter of the other large cohorts as well, whether they're clinical cohorts or community cohorts. But CanPath is an interesting one because over hundreds of thousands of Canadians have consented to do something. So while I agree with Michael's comments about some of the strengths of Canada, the foundation that Canoe has actually delivered, Michael, I might argue with you a bit if I was in the room about Canada's success with linked data. Well, actually, it's a small step forward. It's actually not to where we can go, but with there are many barriers to bringing data together across provincial borders, and that's what we're trying to do with CanPath. We're working with the data custodians in each province. And I really thank Nancy Edwards for commenting, well, if ethics committees are actually a barrier for bringing linked data together, Tri-Council can help with that. That's actually not where the problem is. I think the Tri-Council ethics standards are fantastic, constantly evolving, and we can continue to work with that. The problem is actually more at the blurring between whether something is consent-based or not. And then what we can do is demonstrate data safe havens rigorously with protection of privacy in the interest of people with the large cohorts where the people are consented. So the idea of citizen science comes in, working with the large communities and recognizing that, okay, we can actually advance some things that have always been said to be impossible. Bringing linked data together across provincial boundaries is an absolute essential need. And then my final comment reflects back to the wise words of Senator Kucher. So disinformation. So I was one who was in the background of setting up data systems for COVID response. The thing that actually makes it difficult for individuals is actually we do need to individual scientists or medical professionals is actually the fact that we actually get driven into the ground by the angry mob. So this is actually a real force. It's something that is beyond the individual scientists. It's one of the reasons why the collective that you're representing is fantastically needed, because it opens up dialogue, it connects with frontline communities, and we can actually continue to demonstrate value and benefit while addressing any risks. So really my comment is largely to thank you all and maybe see if Michael agrees that we still have a ways to go with linkage in Canada.
Michael, you've been asked to comment or to respond directly, and I'd like to ask other panelists if they wanted to add any comments.
Yeah, I mean, I wouldn't disagree. I mean, certainly there's more to be done. My comment was really compared to elsewhere in the world, we're leaders and we should capitalize on that.
Bravo.
Great, thanks for those insights, John. We have Philip, and then we have 2 comments online. Philip?
Philip Awadella again. So I think my question's for David and or Trevor, and just because I don't know what's out there. So there's a thing called the Global Alliance for Global Health, and it's largely about developing data standards and harmonization. So David, your comments before kind of brought me back to that thought as to something that I think is needed is our truth sets. And or data sets that are clearly well harmonized, such that if we're thinking about data complexity and we're going to be building, I don't know, artificial intelligence engines that are going to be predictive of how climate change is going to be impacting health, do those models exist? Are there, like, the example I can think of is that the genome in a bottle where everybody can go analyze the same genome and then you develop your tools on that. Are there similar sorts of systems in context of environment, climate change or climate data or air pollution exposures? I think those things would be critical, and it could be something that we have to be thinking about in the context of an institute. Is what are those standards, and are there data assets that can be used for training purposes?
Thanks, Philip. David?
Yeah, so I think where we do have them are for the kind of reductionist studies. So I'm not as familiar with the data systems that are available in Canada as those in the United States, but we have the the EPA ambient air monitoring data, for instance, that is a historical record. We have the NASA and NOAA satellite data for air pollution that could be used. We have the NHANES data for biomonitoring of so 250 some analytes, but over 20 years in different cohorts. So it's not directly relatable data. So we do have some sets. But if we're trying to look at something that is a true comprehensive exposure assessment, I think that's a major gap. To have a data set that is complete truth and well validated, I don't know that is something that exists.
So you're next.
Sorry,
please, Trevor, go ahead.
Since that was also directed to me, I think. 2 quick points. One is it was a couple of qualitative researchers some years ago who took a line of TSL and expanded it. Where is the wisdom that is lost in knowledge? Where is the knowledge that is lost in information? Where is the information that is lost in data? You take the example of climate change. It's not lack of data that is leading to lack of action. We've got all the data, all the science you could possibly wish for. So that's not the problem. The problem is, how do you translate that knowledge into action? And that's why we need an institute and a place to land, as David said, that encompasses political science and social science and the arts and the humanities and business and law and all of those other ways of knowing and knowledge about not just what is the problem, but how do you make change in society? Because that's really the challenge we face. We have more than enough knowledge to say we're causing a big problem. What we don't do is translate that effectively. So data gets you only so far if nobody acts on the data, and understanding how to get populations and political leaders and others to act on the knowledge we already have is really the challenge we face.
Thank you for those insights. Nicole, did you want to add something?
Not particular on this. I have some comments, but maybe I'll wait till it sounds like there's some other questions there, unless I can go off topic for a sec.
Please go off topic, and then we go to the 2 questions. We still have about 20 minutes ahead of us. Go ahead.
Sounds good. I should say on topic, but a different stream, different stream of the river. So one of the things I wanted to just comment on in regards to the structure, because there was some discussion before about sort of this or sort of this thread approach through existing institutes comparatively to a standalone. And in the Indigenous health was used as an example, and Indigenous health, of course, has a stream throughout all of the subsections, but we do also have an institute for Indigenous health as a part of CIHR. So it's not exclusive to just because there's an institute, there's not a thread that still flows throughout all the other components as well too. We recognize the importance of ensuring representation across the tri-agencies, but at the same time recognizing the importance of having a concentrated effort within an institute to be able to move forward the initiative. So I think there's some similar overlap perhaps here in regards to that, it's not a one or the other in the context of Indigenous health. It's both thread across, but also in an institute as well. And that obviously, there's pros and cons, and there's always debates about whether or not we need to pull out, and make a super institute, so to speak, in Indigenous people's research generally, or whether or not it's appropriate in the structures, and those things are to be determined. The other thing I wanted to just highlight very quickly was Courtney Howard's words before on the Planetary Health Declaration. And I think it's underestimated the impact of having not only the deans of all the the majority of medical schools in Canada, as well as medical leaders, specifically sign on to a Planetary Health Declaration. It wasn't just that they were sitting in the room and listening and absorbing and saying, oh, this is great. They actually signed on to the declaration with movement and components of research around planetary health in there. So, having that movement in the Canadian labs landscape, I think is substantial. And Michael Strong actually did a a 5-minute sort of presentation on one of the sessions talking exactly about this issue on the need for planetary health research. And what he noted was important, and I think it's good to highlight, is the advocacy needed at the ministers' level as well as the governing council, but particularly around ensuring that these types of topics can get on mandate letters for ministers, and the importance of that in the political agenda for moving some of these forward, given the complexities I think somebody noted about CIHR not changing in 23 years, but also in regards to the importance of terminology and considering what is the most appropriate terminology to use within these contexts. We've heard a lot of terms out there with very much synergistic components, but really thinking through what that means in the context of application. And then the last thing he was basically stating, which I think is fair, is that from within the CIHR, there's not a very easy ability to be advocacy, but that's what we can do. There's a lot of advocacy movement in this area that can't be done within the federal government structures, and being able to leverage that with the positive movement that seems to be happening in conversations internally, I think would help the game go forward. So just wanted to make those few last points. Merci.
Thank you. That's great. We'll go to a question that we have online, and I see Tim. Tim, can you can turn on your microphone and you can ask your question and perhaps identify your organizational affiliation, please.
Hi, I'm Tim Takaro. I'm a physician scientist, internist, and specialty trained in occupational environmental medicine. And I'm at Simon Fraser University, Faculty of Health Sciences. This has been a fantastic discussion. I really appreciate all the offerings here. My question, I'm not sure if Senator Kutchner is still in the room, but any of the panelists could address it. It relates to the way we are thinking about health and disease, and in particular, this disease model that we've been following for, well, depending on how you count, in some cases, hundreds of years. It's not really working for today's problems. For example, planetary change, racism, inequality, massive famines, and climate disasters. And my question is related to how we approach this, how we think about it. And one of my colleagues in the One Health world thinks about it in terms of harm reduction. That's Craig Stevens. And harm reduction puts you upstream. It prevents disease. And surely this is more economical. Certainly it's more humane than waiting the way we have for diseases to declare themselves, and then we can figure out how to treat them. Surely it would be more efficient and again more humane to prevent them and to go upstream with a harm reduction approach. And I'm curious about, well, again, the senator, if he's there still, or any of the panelists who know about harm reduction, some of the programs that we've been managing, for example, here in Vancouver.
So just for information, the senator had to leave, and so he's no longer with us, but I'd like to open the question to panelists. And I understand that it's about the definition of disease and the potential of harm reduction in prevention of disease. Do we need to rethink the way we're conceptualizing health and illness?
Yeah, thank you. That's a very important point because we've sort of lived it with the pandemic where we've been very responsive, but less on the prevention side of things. Now, of course, once a pandemic has been declared, you have no choice but to respond. But I feel like now is the time to start thinking about how do we focus more on prevention. And I think we could go back to some of those concepts around understanding the drivers and understanding not just for emerging pathogens, but for anything that could cause potential downstream harm, right? So if we understand the drivers, if we understand what is needed to build resilience, and I'll come back to that broader concept of immunity, not just based on, the cell or the host or population, but just a broader ecosystem immunity, and how protective that would be across a whole range of different diseases. I feel like that might be a really important opportunity to really focus on health and well-being rather than responding to infectious disease and have a very pathogenic view of health.
Thank you. I see that both David and Trevor have their hand raised. I do not know who raised their hand first.
I think Trevor was first.
Trevor, please.
Thanks. Well, obviously I endorse what Tim has said. I work in public health. That's the business I'm in. I graduated in medicine, but I sometimes say I later graduated from medicine to health. But they're very different things. And so I think we're talking about how, as I said earlier, how do you create conditions for good health? And the challenge in what we're talking about here, to go back to a point I made earlier that Naomi Klein made, is that when you take this seriously, when you go upstream, then you have to question everything and you have to change everything. No, I wouldn't say starting with, but one of the more important things we have to change is the economic system, an economic system that discounts nature, that ignores nature, that excludes nature, and has done all along. And that's a good part of the reason why we're in the trouble we're in. So we need to be working on what sort of economic and other policies. If you look at the Geneva Charter for Wellbeing, which is the sort of latest iteration, if you like, of the Ottawa Charter from almost 40 years ago now, the Geneva Charter for Wellbeing talks about, the first three things it talks about are essentially making peace with nature. There's the first one. Creating an economy that is good for health is the second. And developing healthy public policy for the common good is the third. And those are three big areas of health and environment research that we need to be in. But what they're focused on is not detecting disease or detecting individual factors that contribute to disease, although that may be a piece of it, but it's more how do you not only protect from harm or reduce harm, but how do you actually create positive health promoting environments? So yeah, definitely harm reduction, but I'd go even further upstream and look at how you create healthy environments.
Thank you. There's David, and then we have two questions online and two people here in the room. So David, please go ahead.
Yeah, so Tim, I think that everyone in the room in the Zoom would agree that it's not a question of if we need the mindset change. It's how do we actually drive that when there are billions to trillions of reasons why we should maintain status quo. Just speaking from an economic perspective, there is so much investment in maintaining the way we do it now that building a concerted effort to change that mindset and promote health and wellness rather than managing poor health, which is the way our system is developed, particularly in the United States. How to do that, I think, is the major challenge. I think that's the real motivation for the theme we've been pushing at NIEHS for the last few years of precision environmental health. If we bring society out of it and focus it down on the individual and identify what are the things that are impacting their health in a negative way, and how can we tailor behavioral modification or local policy modification to be able to improve the health of that individual and by extent their community, we begin to take steps towards that prevention of ill health and promotion of positive health, and that we can then scale. up to their community and then to larger society. I think maybe that's a way of making it a tractable problem that will have multiplying effect downstream.
Thank you. We have about 8 minutes left to this session. And so what I'm going to do is I'm going to ask the people online as well as the people who are in the room to state their question. And then we can give the opportunity to each one of the panelists to make, to formulate a response and make a closing comment. So please, online. I'm sorry, I can't see what name is written. Is it, please name yourself.
Blake Poland.
Blake. Hi, Blake.
Hi. Good to see you again and to be with you all, although I wish I was in the room. I'm at the Atlanta School of Public Health at the University of Toronto, and I've been really enjoying this conversation. In some ways, it really feels like a bit of a family gathering in some ways. And so I guess one of my questions is about thinking about this gathering as a community of practice in environment and health research, as a relational ecosystem. What are we going to be doing to foster and enhance this relational ecosystem? I think of Trevor's proposal for an institute as one way of doing that, but we might think of other ways of doing that. I guess the issue I'm struggling with more broadly here is I think we end up in much of this work falling into the dominant modus operandi for our fields, which is risk management. And we develop the research base and the evidence in a sequential fashion to try and build up the weight of evidence sufficiently to support action. And yet we know that the timescales on which action is required are much more urgent than that process would allow. And especially in the absence of a precautionary principle driving this work, the weight for that weight of evidence is one we can't really afford anymore. And I think more to the point, from my perspective, risk management is mostly about trying to solve the problems generated by the dominant system without actually addressing the underlying drivers. So to Tim's point and points that Nicole and Trevor and others have made, it seems part of what we're not talking about, and I see that I can't, I was going to share something as a share screen, but I'll skip it. It doesn't seem to allow me to do that. I guess what I'm struggling with is how do we make the bigger paradigm shift that Nicole has pointed to, from the ego to the eco consciousness? How do we embrace a relational worldview so that we're living more in sacred reciprocity with all of life? What do we know about how to do this, and who's looking at this? Is this part of the portfolio of the work we're looking at? Because I see us talking more and more about the need to think about these issues, not just as technical problems, but in a way, I think of it as relationship problem. We've fallen out of right relationship with ourselves, with each other, and with the more than human world, with Mother Earth. And I think we need to be doing work to address those fundamental issues. And I would love to hear what some of the panelists have to say about that, and how we can bring that work into the proposed institute and into some of the work that we're doing and funding.
Thanks, Blake. I'm going to ask the people in the room and that are online to provide their questions, and then we'll do a round of responses from the panelists. So here in the room, please go ahead.
Richard Bennerjack again. In follow-up to some of the points, but I think it's worth expanding. If some of you haven't read the book, How Do You Speak to a Science Denier? It's worth reading, because in there, some of the principles that are spoken of, you don't just come with facts and expect the person that is the science denier to change their opinion. You have to listen to them, you have to gain their trust, and you have to, over time, then you come in with some facts, but then you say, or ask them first, what kind of proof would you need in order to change your behavior? And I think as scientists, we need to do that in sort of the advocacy arm of this institute that we're talking about, we have to sort of go there and say, if we're going to be able to implement change for you, what would you like to see? Would you believe that if we came to you with such type of evidence, would that actually create change, whether it be at a policy level, whether it be at a regulatory level, or even whether it be at a community level? But I think reading that book actually is very educational, but that we can take away from that many lessons and then put some of that into the directions of a proposed institute or infrastructure, whatever you want to call it.
Thank you for that comment. Again, we'll wait for one more moment. There's John, you had a comment?
I'll be very brief. One thing that hasn't really been said very much in the first day and a half is commercial determinants of health. So one of the forces, and one of the many forces that maintain the status quo are essentially these commercial determinants. In environment, those forces are both for and again what we've been talking about. So just having a placeholder in the model for going forward to ensure that those commercial determinants can be brought into the tent in a positive way, I would encourage. I'll pass on the baton. Thank you.
Thank you, John. And I think Jeff wants to get in a last word. Jeff?
Well, hopefully the panel's going to have a last word, and great thoughts so far and some great things to try to follow up in our short time there. But I'm just trying to think really big. You know, one thing that I would like to see is I'm not sure how many weeks or months ago, we had a lot of media around all the health ministers coming together trying to get more money from the federal government. And I thought, wouldn't it have been great if part of that conversation was, because this speaks to, obviously the money that has to address issues that Mike talked about aging populations and the challenges that are faced, but how do we get right into that highest level of conversation, this recognition of prevention that's talked about, the recognition of environment, and the benefits that can be gained to Canada. But I think that's where we need to aim in terms of the level of where it needs to be discussed is right there at the spending of healthcare dollars and allocating it in the country.
Leave it now to the speakers. There were 3 or 4 ideas that came forward. How do we make a paradigm shift? How do we speak to science deniers? What do we do with the commercial determinants of health? And how do we mobilize action? So in any order, please try to respond and provide some closing comments. No order chosen. I will choose the same order that we started with. Nicole, your thoughts.
Yeah, no problem. There's an indigenous philosopher by the name of V.F. Cordova, and she states the Euro-American does not acknowledge that he has an inherited worldview. An awareness of an inherited worldview is not necessary as long as all of one's communication remains within a very narrow circle of one's like-minded fellows. And I think this speaks to the entire issue of the problem. It brings in disinformation, it brings in the societal change, it brings in so many components that when we're trying to create solutions in the frame of like-minded fellows, we're always situated within one perspective that we see of the world and not necessarily the one on the other side of the cup that others may be looking to. No one right or wrong in essence, because at the end of the day, families are worried about getting food on the table. They're worried about paying their bills. They're worried about ensuring that their kids are doing well. And we forget to bring this down to that level. I got asked an interesting question yesterday in a workshop when I was at the previous conference, and it was by a woman who was in Saskatchewan, and she was saying that I'm having a hard time talking about these issues because of the political issues, some of the disinformation that's around. And what I said is, having the experience of been in North Dakota for the last 4 years, which I'm sure many can imagine is not a liberal hotbed, so to speak, in the context of the environment and climate change. And I had the great pleasure of presenting at the Academy Family of Physicians in North Dakota and Montana, which also, there's a lot of complexities in talking about this topic. And And what I found most successful in this area is bringing it back not to issues, to context, to conflicts, to things that we disagree with, but to human. And by bringing it back to that human to human level of conversation, realizing that farmers, they're some of the most ecologically connected folks. They know their lands, they know their animals, they know everything in that area. We're just not using the language of human to human in those conversations. When we come in assuming there to be conflict, assuming there to be disinformation, assuming there to be a lack of understanding, we automatically create a frame of mind in that interaction with that person. And that is why we are failing the disinformation network. It has nothing to do with the strategies, the techniques, that's the science. We've brought the human to human connection out of those conversations and the experiences. So I just wanted to share that because I think it brings for me the importance that overlays this entire conversation is that we are talking amongst like-minded fellows and bringing back the wisdom of some of the Indigenous philosophers where we do have these inherited worldviews that we don't have to explain because everybody else around us is assumed to have the same frame of reference in mind. And one of the skills, that I've seen from Indigenous folks coming in who have been essentially forced to dance within two separate worldviews and to figure out and to gain some experience in how to do that, how to look from different perspectives and to be able to see different viewpoints that might not be our own. So thanks for the conversation today and having me. It's been a pleasure. Merci Cho.
Thank you. Pleasure has been ours for sure. Trevor.
Well, thank you. Nicole just put me in mind of a favorite quote of mine from many, many years ago that I've used from George Bernard Shaw. The reasonable person adapts themselves to the world. The unreasonable one persists in trying to adapt the world to themselves. Therefore, all progress depends on the unreasonable person. And I've sort of spent a lifetime trying to be an unreasonable person on the strength of that, and will continue to do so. So yes, I think we need to be thinking big. We need to be thinking upstream. We don't need to be tinkering with existing systems. I thought the comment about the fact that CIHR hasn't changed in almost 25 years is very revealing. I mean, talk about all the more reason to change. 25 years have passed. The world has changed. It's time CIHR did, and the other institutes for that matter. So I think we've got an upstream battle. Not upstream, what's the word I want? Anyway, it's a big battle to shift all of the perceptions that people have been talking about. Thanks to John McLaughlin, who I see has gone offline, but his comments on the commercial determinists exactly. I mean, when I'm talking about the economy, that's what I'm talking about. I think thinking about, for example, the whole work on exposome and exposures to toxics. To me, the issue has always been one that Donald Chant and Ross Hume Hall highlighted in the 1970s in a brilliant little Science Council report on ecotoxicity, back in the days when we actually had a Science Council, incidentally. The real issue is not a sort of chemical by chemical understanding or all of that. It's that we are all born with a body burden of persistent organic pollutants and other contaminants, and not only us, but other species with whom we share this planet, because we have polluted the entire ecosystem with our persistent pollutants. So how do you change that? They're out there. We're not going to get them back, that's for sure, except through bioconcentration. So at the top of the food chain, we do end up getting them back, but not in good ways. But that comes out of a commercial imperative to sell product and get it out there. So yes, absolutely, the commercial determinants of health. And what I think we need to emphasize on the positive side is the health co-benefits of living in a more sustainable way, in a way that respects the earth, that respects that pale blue dot that Carl Sagan talked about, that recognizes us as one small part, but a very powerful part of the overall planetary ecosystem, and recognizes that we share that with many other species, all of whom have their own rights to exist. So it does come down to a set of values and principles, and Tim Beazold, a health futurist friend of mine, always likes to say that vision is values projected into the future. So let's be clear what our values are, and then we can figure out what our vision of a healthy future is, because that's what we need to be striving for. And research in health and environments needs to help us get there.
Thanks, Trevor. That's great. Samira.
So I know we're over time, so I'll be brief. Premièrement, Lise, merci beaucoup. You've led a very enriching conversation. I actually feel the better for it. So thank you very, very much. And to everybody in the room and online and all the participants. And I know he's not here anymore, but to the Senator for leading these important efforts, especially around Bill S5. I'll just maybe pull on a thread that I think Blake started, and that was really mentioning reciprocity and reciprocal care. If I had, well, I guess it's two words, it's not the last word, it's two last words. I think that's really something that resonated, and I'll be leaving this room thinking about that in more depth and how we can actually do that. And I think it also relates to what Nicole was saying about relationships and echo chambers, how we really need to get out of our echo chambers and build relationships with others. When I go back to rural New Brunswick, I can tell you that a lot of people there feel very left out of the conversation. They haven't been included, despite the fact that, you know, they're far more connected to the ecosystems that we are talking about in this room here today than even myself anymore. So I think that that's something that I'll be taking away and hopefully doing something about on a personal level as well.
Merci à vous. David.
Yeah, I will also keep my words short. I think that we're all kind of converging around a theme here, which is I will add my quote to it, which is the Albert Einstein quote that we can't solve problems by using the same thinking that we use to create them. And we need to change our own mindsets first. You can't change anybody else's, but you can modify your own mindset and your own way of seeing the world. And by beginning with yourself, you can begin to influence others. I think that we are at a tipping point as a community, we have a radical belief that we need to change, that we need to address the world's larger problems. And it is time for us to start those conversations with others to get them to come along with us.
Thank you, David. Michael.
Yeah, I think much of this conversation, has really been about the need for, fundamental societal changes. I would just sort of take the climate lens on that. So that's mitigation, right? And that is unfortunately going to take time. At the same time, we need to deal with adaptation. So it's with us. What are we going to do? What do we do to the senior who is faced with an extreme heat event? What do we do with protecting our population from wildfire smoke events that will be with us for the next 50 to 100 years? So we need to do both, and we need to keep our eyes on that. I don't think we should be fully going into societal change. I fully support that. It's going to take a long time. We need to also remember what's right in front of us today.
So it's my pleasure, but also a little bit sad to stop this conversation, but a very warm thank you to all of our panelists, and thank you for all of your thoughts and this lovely discussion that I hope will continue.